In today's video, we will discuss about who Hildegard Peplau is and her contributions in the field of nursing, an overview of her interpersonal theory and its meta-paradigm. Lastly, a short review about the video. Hildegard Peplau was born in 1909 in Reading, Pennsylvania, and died in the year 1999. She is known as a mother of psychiatric nursing because of her theoretical and clinical work that led to the development of the distinct specialty field of psychiatric nursing. She is also known as a psychiatric nurse expert, educator, author, and lastly, a nursing leader and theorist. In 1931, she graduated in Pottstown, Pennsylvania School of Nursing. Peplau earned her degree of Bachelor's in Interpersonal Psychology in 1943 at Vermont. 4 years later, in the year 1947, she got her Master of Arts degree in Psychiatric Nursing. During the 1950s to 70s, she developed the first graduate program for clinical specialists in psychiatric nursing. Throughout her career, she contributed a lot of things in the field of nursing, including her theory of interpersonal relations, her humane way of treating patients, and reshaping the mental health system in the US, which developed the National Mental Health Act of 1946. Moreover, she is known to advocate for advanced education for nurses and the nursing career in general, as well as research in nursing. Peplau also helped in making an advanced professional, educational, and practice standards in nursing. She also participated in government policy making and ultimately emphasized on the importance of nurse-patient relationship. Peplau published her book entitled Interpersonal Relations in Nursing in 1952, which is about the theory of interpersonal relations which is relevant to the work of nurses. Peplau's interpersonal relations in nursing theory focuses on the therapeutic nurse-client relationship by using problem-solving techniques to meet the needs of the patients. This theory is greatly influenced by the interpersonal relationship theories of Freud, Maslow, and Sullivan, as well as by contemporaneous psychoanalytical model. Let's talk about the meta-paradigm involved in this theory. According to Peplau, nursing involves a human relationship between an individual who is sick or those who are in need of health services, and a specially educated nurse must recognize and respond to the need of these individuals. The environment, on the other hand, is referred as an existing force outside the organism and in the context of culture. Peplau also mentioned that health is a word symbol that implies forward movement of personality and other ongoing human processes towards a creative, constructive, productive, personal, and community living. Lastly, the person is considered as a developing organism that tries to reduce anxiety caused by needs. Here are the major concepts of Peplau's interpersonal relations in nursing theory. Nursing is an interpersonal process because it involves interaction between two or more individuals with a common goal. This goal can be attained through the use of series of steps following a series of patterns. In addition, it is also considered as therapeutic or a healing art assisting an individual who is sick or in need of healthcare. It also emphasized in her theory that nurses should apply the principles of human relations to the problems, as well as working together with the patients to become mature and knowledgeable in the process. The following are the 6 major nursing roles introduced by Hildegard Peplau. First is stranger. The nurse should offer the client the same courtesy and respect as the nurse would to any stranger. Second is resource. The nurse answers questions on health concerns and let clients understand the problem or situations. Third is that the nurse could act as a teacher who imparts knowledge. Learning could be instructional or experimental. Fourth is counselor. The nurse helps the clients understand the circumstance and provide guidance and encouragement. Fifth is surrogate. The nurse serves as a substitute for another such as a parent or a sibling. Lastly is leader. The nurse helps client assume maximum responsibility for meeting treatment goals in a mutually satisfying way. Here are some additional nursing roles. Technical expert. consultant, health teacher, tutor, socializing agent, safety agent, manager of environment, mediator, administrator, recorder observer, and researcher. There are four phases of interpersonal process or relationship. The first phase is known as the problem-defining phase, which is orientation. This is where the client meets the nurse as a stranger and asks assistance and express preconceptions and expectations. The nurse will then respond and help to identify the problem. The second phase is what we call identification, where the client works interdependently with the nurse and begins to select the appropriate professional assistance. In this phase, the patient starts to have a feeling of belonging and capability of dealing with the problem. The third phase is exploitation, where the client makes full use of the services offered. This is also where the nurse aids the patient in exploiting all avenues of help and progress made towards the final step. Lastly, when a client no longer needs professional services and gives up dependent behavior, it proves that the patient and nurse are in the resolution phase. This is the last phase wherein the nurse-patient relationship ends. This diagram shows the factors influencing the orientation phase according to Peplau. The factors in the nurse's part are the following: values, cultures, beliefs, past experiences, expectations, and preconceived ideas, while the factors in the patient's part are the following: values, cultures, belief, past experiences, and expectations. All these factors could influence the nurse-patient relationship in the orientation phase. Peplau also made a comparison between her theory and the nursing processes. According to her, both are sequential and focus on therapeutic relationship. Moreover, both use problem-solving techniques for the nurse and patient to collaborate on with the purpose of meeting the patient's needs. It also used observation communication and recording as basic tools utilized by nursing. In this table, it shows how the nursing processes are in contrast with the interpersonal theory. In the assessment process, this is where data collection and analysis occurs, yet it may not be a felt need. The nursing diagnosis planning is a process where the patient and nurse mutually set goals. We also have the implementation process, where plans are initiated towards the achievement of mutually set goals. This can be accomplished by patient, nurse, or any family member. The last nursing process is evaluation, where it is based on mutually expected behaviors and can lead to termination and initiation of new plans. On the other hand, the orientation phase has a non-continuous data collection, and it is a felt need. The identification phase has this interdependent goal setting involving the patient and nurse. The exploitation phase is where the patient is actively seeking and drawing help, and he or she will be the only one who can initiate it. Last but not the least is the resolution phase, which only occurs after completing the other phases, and is the only phase that could lead to termination. Here's a short summary about Hildegard Peplau's biography and all about her interpersonal theory, which includes the meta-paradigm, the 6 major nursing roles, and the 4 phases of the interpersonal processes. Before this video ends, here's a short quote from Dorothy Gregg about Hildegard Peplau. The most consistent hope for progress, no matter how troubled the situation, is the truly intellectual person, educated lifelong and continually involved in the problems and growth of the field. Hildegard E. Peplau is that kind of person. That's all. We hope you learned something about Hildegard Peplau and her interpersonal theory.